Welcome to the Health Storm. I'm Vic Gatto, your host. I have a great show today with Nikila Ravi of the Banner Health Group. She's an incredible guest. Banner is really on the forefront of figuring out how to bring innovation to solve for the coming changes in healthcare that we talk about on the show. She has brought, with a group of other people, design thinking and innovation around the process that no one else in the country has done. There's a lab group and a ventures group that she's been involved in both. She's really a great guest. I learned a lot on the show. I think you will too. Please watch it. Nikila Ravi with Banner Health. Thanks. Nikila, thank you for coming. I'm excited to have you on here.
Thank you for having me.
So before we get started, just quickly give me a little bit about your background.
Sure. So I actually went to the University of Michigan for industrial engineering. That's where I started my career and worked with the VA health system for a number of years, worked with independent consulting.
As an industrial engineer with the VA?
As an industrial engineer, yes.
Yeah, excellent.
Correct.
Okay.
They have a Center for Applied Systems Engineering, and so it was a great group to be part of, especially right out of college, really getting exposure to the healthcare industry.
Right.
And then worked in independent consulting for a little bit, and eventually made my way over to Banner. And I loved making my way over to Banner because it really started to introduce me to my passion and give me an avenue to really drive my passion forward, which was inspired by an experience I had in high school where I was actually admitted to the ED and had some health issues at that time. And my father is a physician and at that hospital. And so he was really able to be my advocate throughout that whole experience.
He could sort of be with you and help you through it. Yeah,
exactly. So he knew what was happening, when to trigger what levers, and was really able to guide me through that entire experience. Aside from the fact that I was there for a health issue, it was a really smooth experience. Yeah. And so that's
How old were you? A teenager?
I was 14 when I first went through that.
Yeah.
So very young at that time.
Yeah.
And it was an experience that really was life-changing for me personally, but it also really opened my eyes to the fact that most consumers don't have that sort of advocacy. And it's not possible for a health system or a company to really provide that for every single patient.
Yeah, it's scary, and there's all these words that are confusing, and people coming and going.
Yeah. Definitely. Yeah. So my passion now is really towards, healthcare transformation, towards a vision of care experiences that are easy and seamless and efficient, with the focus on guiding patients through the system, helping them live their healthiest lives on their own terms. And
it's really interesting that you're bringing an industrial design, industrial engineering background to this rethinking, transformation of the healthcare system. Right? You're trying to give a great experience for people through bringing industrial engineering to the table. Right?
Definitely. Well, industrial engineering at its core is really about the processes and how we can make that efficient, but also how we can be very human-centered and consider human design.
Yeah. Yeah, and I'm lucky to get to interview you in person because you're here in town.
Yep.
You're getting your MBA at Vanderbilt.
I am.
So I was, we're blessed to have you come to town for another reason, but be able to sort of pull you in for this.
Well, and I'm so glad to be here with you today too. Yeah. So it's been a great opportunity and a great timing.
Yeah. Excellent. So tell me about your role at Banner. You're a program director in the venture group. Is that right?
That is correct.
What does that involve?
So for us, that involves really looking at how do we create and grow our internal and external partnerships in the innovation ecosystem. So we will look at our company's priorities. We're going to evaluate the landscape in relation to those priorities, assess any strategic fit or cultural fit that we might find with potential companies.
So when you say priorities, does the executive team from all of Banner, did they say, here's our strategic direction, and then how would innovation, how would venture fit into that?
So we have our strategic themes that will guide our work, but we also will work with our operational leaders to understand what are your priorities in your area at this point in time, as well as over the upcoming years.
Okay.
And so that's a way for us to understand, where are we right now and where do we want to go? And so we are in close connection with all of the operational leaders within Banner to really keep this front of mind as we do go out into the industry, into the landscape, and understand, hey, we see this company that's doing this great thing. Does that really align to a problem that matters to us? And that's one of our first priorities that we'll look at.
And are you making cash investments? Is it in kind? How does Banner think about the investment of time and capital and energy and expertise into a company?
It's interesting that you bring that up because we're really looking at all of the above. So we do have some financial investment that we are able to make, and that's really going to be with a lot of the early stage companies. Is what our focus is right now, and that's one way for us to really partner with a company. But then we also can partner with companies with our resources that we have within Banner. So maybe we are a test site or a beta site for a company that's looking to prove their solution.
And that might be as valuable or more valuable than the cash investment.
Exactly. And there's also the opportunity for co-development. So maybe we will fund as well as work with you to develop something as well.
Okay.
So yes, we
Great.
have all of the above.
Well, thanks for joining me. As you know, this is called the Health Storm, and it's named that because I see a pretty big storm sort of on the horizon coming to the healthcare industry.
Yes.
And as you know, we're both in it. It's $3 trillion a year, the biggest industry in the world, affects 20% of the economy, and yet it hasn't really experienced a lot of innovation, a lot of change in the last 50 years, maybe since DRGs in the 80s. And so the thing that I'm interested in is, what do we see on the horizon? What parts of this storm are going to hit first? Maybe as you see, maybe like a good analogy is with a hurricane coming in, what outlying areas is going to hit first? How should we prepare people for that? And there's really a couple trends that are driving my belief of this. And I want to just sort of talk about that and then get your impression of, are these real? Are they not real? What parts make sense to you? What parts you think, I'm a little bit exaggerated or not on target with? And so they all sort of come together in this health storm that I think is going to have a big impact. But let's take them a piece at a time. Okay. So
let's do it.
The first one is the rise of the consumer. And it's interesting, your passion is really around that, right? So
Absolutely.
I think consumers want to and really going to demand taking control of their own health, wanting information, access, knowledge, decision, kind of authority over where it goes.
Absolutely.
And the health systems are not currently designed for that. It's more the physician at the center, and we need to shift to more the patient at the center. And that seems to be really core to what you're thinking about and what you're passionate about. So talk about what you see with that and mostly the timing of that. How is that going to roll out?
I think that timing is going to be, we're experiencing that now, as well as, in the future. I think timing is a really interesting concept, especially when you apply that to healthcare, because we have so many imperatives that we're trying to achieve. And one of the greatest ones is around this consumer focus. And this consumer focus, I think, when you think about the timing of it, you can think about the horizon model that McKinsey released a number of years ago with their 3 horizons. And, that's how we time box some of the work that we do, saying that we're going to see these things happen in the relatively near future or now, but we also see the future beyond that, the further future.
So in sort of what I'm calling the rise of the consumer or consumer-centered care, what do you see in the sort of now and in the next horizon and the next horizon? What do you see coming out in the future?
So I'd say right now we see a lot more of a focus in terms of the traditional customer service types of principles. So you can see influences coming from retail, from finance, from hospitality, where consumers are interacting with those industries and they have a certain level of expectation that they have in those industries. And that doesn't change for healthcare just because they're in a different industry. And so I'd say that's
so they get frustrated because at banking or hospitality or a restaurant or retail, they have a certain level of experience, and that so far that hasn't translated that often to the healthcare system.
I think we're making strides in that direction, actually. So some of the things that we're doing at Banner is we're really trying to increase that focus on the consumer and increase the transparency. We've done some work with chatbots and bringing those to our consumers to be able to interact with them in a more high-touch way that really increases the transparency of where they're at in their process. We are also looking at various solutions to be able to increase the transparency and coordination of their care. And so, the different solutions that are sort of coming on the near horizon are really focused on how do we sort of give that experience to our consumers that is equivalent to their expectations that they have in other industries.
And one of the ways that Banner can really differentiate itself and sort of lead the trend is bringing some of these expectations to bear, where you can really sort of satisfy what the customer wants, maybe exceed expectations, and make Banner stand out as sort of across the country as one of the best places.
Yes.
So maybe one of the challenges for the industry can be a real advantage to a place like Banner that is thinking of things.
Sure, definitely.
The next one is that I see care sort of moving out of the hospital to the community and the home. And so, it used to be that within the four walls of the hospital, pretty much all the care happened there.
Right.
And then over time, you're starting to see more and more procedures, more and more healthcare migrate its way out to lower cost settings, more convenient settings.
Yep.
Of course, started with the ambulatory surgery centers several years ago.
Sure.
But now you're seeing more and more acute cases migrate out of the hospital. And so talk to me about that trend, and do you think that's a real trend, or how do you see the different horizons, to use your same analogy, in that process?
Sure. I think that's a very it's a trend we're seeing today, for sure. We see a lot of care moving to the community settings, to the home, as you mentioned, and it's really important because that's what our consumers are asking for.
Yeah.
And so you even see the rise of telehealth to really be able to deliver on that as
Right.
well. So there's a number of trends that we're seeing that are really delivering around that premise of how do we bring care to where the consumers are at. But I don't know that that really means that we're going to move care completely out of the hospitals, because hospitals are still at the hub of the healthcare ecosystem. And we need those resources to really provide the level of services that consumers inevitably will need at some point in their life. And so it's more so, how do we really change the dynamic from episodic care to a relationship with the health system at each point of a patient's journey. So we're really with them for their entire journey.
Yeah, so let's dig into that, because that's not really exactly the trend, but I agree completely that moving from an episode of care where I get sick, I come to the hospital, you patch me up, and I leave,
Yep.
to more of a lifelong relationship where
Absolutely.
you are my health provider for my entire life. And
Right.
of course, I'll have times in my life when I need more care, but there'll be always that I'm with Banner or with my health provider.
Sure.
In different settings. So it may be a telemedicine engagement. It may be, local community. It may be that you send someone to my home.
Right.
But then when I need to have, triple bypass surgery, maybe I ought to be in the hospital.
Yes.
And
Yep.
so Banner, I don't want to assume, is Banner sort of taking that different approach of trying to engage with the consumer, with the patient for their entire life?
We would absolutely like to engage with a consumer for their entire life. And that's really a big focus for us, is how do we create this relationship with our patients. So we are an integrated health system. And so with that, we offer services that our patients can really take advantage of at each point of their journey. And so we'd like to ensure that we are inspiring that loyalty and really helping to grow our reach towards those consumers wherever they're at in their journey.
Yeah. How do you think about branding and marketing? Like, part of that staying with the consumer, the patient for their entire journey is building a brand relationship where they don't necessarily have to know which physician they're going to see, but they want to see a Banner physician. Just like, so I drive a Nissan Pathfinder,
Right.
and I'm very loyal to Nissan for no reason except I've had great success with Nissan, and it's done really well, and they sponsor my podcast. Thank you, Nissan.
Thank you.
Just kidding. But I think healthcare has never really thought about that until the last few years. But if Banner wants to sort of be a lifelong partner, you sort of have to begin to be branding.
Absolutely. And, I think it's a question that a number of people have been asking, is what does loyalty mean in healthcare? And I think it's a question that we're also asking as well.
Yeah.
And do we have an answer to that? I don't know that we do just yet, but we are working towards that in a number of different ways. We have consumer engagement strategies. We have our innovation strategies. We have various ways that we're saying, how do we meet our consumers where they're at to provide them the care that they need in the right place at the right time? And that strategy is how we're starting to look at that relationship. But what does it mean to be loyal in healthcare is a question that I think we're all still trying to answer and still exploring. And I think it really depends on the driving motivators of loyalty. And that's different in when you're buying a car and when you're banking or when you're going to the Marriott hotels or whatever hotel chain you choose. You have different motivators. And so what are those motivators in healthcare? Something to explore.
Maybe it's different. I'd challenge you on that. I mean, I think it has been different because in the past, the customer of the hospital was often a payer, government payer or a commercial payer or different payers. And the patient was, of course, getting the service, but not directly the customer. And that's shifting. It's shifting pretty slowly, but it's shifting. And I think building a relationship with the customer, building trust, setting expectations, it actually is more important in a very emotionally charged, scary life and death. I mean, you had an experience where your dad could help shepherd you through the process.
Sure.
But it's pretty scary for a 14-year-old to be in the emergency room having health challenges, and if you didn't have your father there, it would be even more scary. And so that's exactly when a kind of good service could come in and really kind of create a lifelong customer because you sort of take care of them, literally take care of them at an emotionally charged, scary time.
Absolutely. And that sort of brings me back to that relationship perspective where by building that relationship, one of the most important parts of a relationship is trust. And so we do want to ensure that we're building that trust so that we have that relationship and we're there for our consumers when they need us.
Okay, so those are the first two trends. The next one is that the technology tools are really building power. Right? So we talked about telemedicine already. There's data science, there's mobile, there's artificial intelligence, machine learning. All of these factors are sort of in aggregate building up. And I don't think that any one is sort of a silver bullet, but I think in the aggregate, they're going to really dramatically affect the way that our society treats healthcare.
Absolutely.
And so how do you think about that, and where is that in the process of sort of coming to fruition?
I think technology is ever changing, ever evolving, and it actually brings me back to a video by a futurist that I saw a couple years ago. His name is Ger Leonard, and he talks about digital transformation and exponential change. And there's a quote or a statement that he made in that video where he said, "Technology is the future, but the bigger future is in transcending it." And it really speaks to me from that perspective of saying that technology is it's going to be everywhere. It's in all of our lives, in our daily lives today already. We all have a smartphone that doesn't leave our sides. It's probably the furthest away from me today than it's been in a while. So, it's part of our lives. It's been integrated into our lives. But how we interact with it and how we let it define us or not define us, I think is really where the future is going.
Does it empower us or entrap us?
Exactly.
And I think, if it's used in the right way, it's sort of freeing, and it can be used, not the right way.
Right. Absolutely. And it's how do we interact with it? What's our role in relation to the technology, and really trying to take ourselves towards that empowering side of things as opposed to the controlling side of things, trapping side of things. And so then the last trend is that I see market entry into healthcare from non-traditional players, right? Absolutely.
So the big technology folks on the West Coast, Apple, Google, Amazon, Walmart, maybe isn't a total tech player, but they're a big player. All these non-traditional folks are moving into healthcare. And at the same time, you have the evolution of existing players where United is now delivering care. They're providing care.
Right.
And of course, I know Banner's relationship with Aetna and CVS. Aetna and CVS merged together, and so they're a very big conglomerate. There are the chairs are shifting around, and I think that is going to be challenging for the existing health systems to understand where do they fit and how do they stay powerful in this new world. So what is your perception of this kind of new market entry?
So it comes back to some of our conversation around the rise of the consumer and how
they certainly understand branding and consumer. Yeah.
Well, and there's a market opportunity now where there is a consumer expectation that has been sort of creating an opening for disruption in the healthcare industry. And it's a lot easier to innovate on the outside and bring that into healthcare than it is to innovate in the traditional healthcare ecosystem and push that out because of things like the regulations that we have, because of various constraints that we have in our industry, really.
Yeah, I mean, that's so I'm a VC, right? That's the advantage that we take advantage of.
Absolutely.
And the challenge of an incumbent,
Sure.
right, is I can cherry pick a very profitable procedure set, a very profitable disease state, and manage them, and only do that. And Banner has all the disease states, fully integrated health system. Some of them are more profitable than others, and yet Banner is in a lot of communities is the dominant system and has to take care of the entire population. And so you have to keep doing all the stuff that Banner has been doing for decades. Some of that takes a lot of work and a lot of capital and a lot of infrastructure, and the payoff is in better health and better for society.
Absolutely. Well, and that's why we also want to create these relationships and partnerships with these organizations who are able to innovate on the outside and bring that to our ecosystem.
Yeah.
So that's being part of the Ventures group. That's a huge opportunity for us, and something that we're really trying to push towards is how do we create a partnership that is using the solution or the innovation that's happened in this area where they can do it quickly. They're in a non-traditional setting, and then we bring in the healthcare expertise, the knowledge, the consumer insights that we have being in the healthcare industry, and marry that to basically create additional value.
Yeah, I mean, I think it's really smart that Banner's doing this, and they hired you to help with it, because it's the innovator's dilemma, right? It's well studied. The established kind of incumbent has to manage all of these things.
Absolutely.
And a large campus and huge amount of employees, and then a Silicon Valley tech company that makes phones can sort of siphon off one piece that's a very profitable piece and do just that.
Sure.
But if that happens enough, then the existing incumbent model falls apart, because some of those really strong profitable areas are subsidizing or helping you take care of folks that don't have insurance or other areas of health that aren't as profitable. And so Banner's being really smart to kind of be in the mix and have you in the venture community trying to work through this at the same time as running the day-to-day operations.
Absolutely.
Yeah.
We're very aware of the entire picture, and we're really looking at the big picture.
Yeah.
So, yes.
And you have, I think Banner has a longer time horizon in how it makes decisions a little bit than some of the investor-owned quarter-to-quarter players that, for reasons we understand, they have to sort of think about things right now.
Sure.
They should think longer term, but I think Banner has done a good job sort of balancing that. We need to do what's right today, but we also need to plan and have a ventures group and be focused on the future as well.
Absolutely. And that really speaks to one of our core driving principles in the ventures group, is that we're not just trying to invest in a company that's going to gain a return, because there's so many ways that we can gain a return off of the capital that we have. We really want to find partners who are going to help us create value for Banner as well as the entire innovation ecosystem.
Yeah, so it's financial, it's what can you learn, it's how can you change the trajectory, it's where can you partner, all of those things.
Absolutely.
Okay, so we've had a good first segment.
Okay. And
I've enjoyed talking to you. Now we get to the more scary part. So that, if you start throwing things at me, at least we have a little bit of footage. I think these trends are going to come together to really be pretty problematic for the existing healthcare system overall. Not everyone is as forward-thinking as Banner is. Not many people have a ventures group or are thinking even a year ahead. They're kind of trying to survive right now.
Sure.
And all of these trends are going to apply pressure, particularly to the health systems that are not dominant, right? So there's 5,000 health systems in the country. Probably 2,000 to 3,000 in smaller communities, a one facility hospital. Maybe they have 2 community hospitals. And I think scared's the right word. I'm scared that the storm's going to come and be really challenging for those hospitals and those physician groups to survive the way they do today. And that we will figure it out the way that the economy always figures it out. But there's going to be a lot of disruption. A lot of people in these communities work at these health systems, and a big tech, player coming in and delivering a lot of telehealth and then shipping you, 3 hours away to an urban hospital may be good for sort of efficiency, but it's going to be really challenging to the people.
Sure. And
so give me your perception of, is the community hospital setting, or those 1,500 smallest hospitals, are they going to survive this coming trend?
I think that there's a broader question around that, where it's not so much are they going to survive, but what are they going to do to plan for the future, and how do they survive it? So it's more so around, what are the strategies to ensure that we're not only treating our patients in our urban centers, but also reaching out to our critical access rural hospitals as well. And how do we create partnerships? How do we grow our reach and our impact to be able to serve both areas, really? And it may not necessarily be about, I live in a rural area, I receive telehealth care, and when I get sick, I need to go 3 hours away. We've been talking about some of the trends around care moving outside of the hospital, so maybe those are the right candidates for some of the in-home options that exist as well. Yeah. So, it's going to look a number of different ways. I think we're going to see the industry transform, and it's going to be based on, what's the value that we can create with the resources that we have. Yeah,
so I think that is a great glasses half full way to look at it. I think that's right. And I think it's going to be this new world is going to be wonderful for patient care. So I think patients will demand very high quality care, great experience, good outcomes, lower cost. And I think if the industry is successful, we will deliver that, right? And so I have a bunch of startups, you're doing startups, Banner's doing things, there's creative minds all around the country that's going to deliver that. Right. What I worry about is the small community doctors and middle management and nurses and staff in a small hospital. They may need to be retrained, brought to different venues. Sure. Kind of like the transition from Main Street stores, where you had a little soda shop and a hardware store and a stationery store and an athletic store. Right. And then all of a sudden, everything now went to the big box store. Right. And we reoriented our workforce over time, but it was painful for a while. Sure. And so I absolutely think that the patients are going to be great. Right. They will have wonderful service delivered through many different ways, some traditional healthcare, some non-traditional. But it's the workforce, which is, about 12% of the U.S. working population. Right. Yeah, it's huge. A lot of people need to be sort of figure out where they're going to go next. Right. And I'm not sure that in small town America, you need to have a general surgeon doing, I'll do one type of surgery on Tuesday, then I'll do 2 more on Wednesday. I never really do the same thing twice. Kind of a jack surgeon of all trades. I think that is going to go away. And unfortunately, that person is going to have to change the way he or she practices. Potentially. I don't know that there's really an answer out there just yet for that question. In a time of change, we talked a little bit about how technology is shifting human roles, and those shifting human roles will also shift others. We're sort of in this ripple effect or domino effect era where as one thing changes, a number of other things are also being impacted. Yeah, we need a ton more home health workers.
Sure.
We need a
Yeah.
ton more nurses. We need
Exactly.
more primary care physicians.
And I think we're seeing different types of clinicians also that we're starting to deploy, such as the rise of nurse practitioners and physician assistants.
right.
Their scope of practice is increasing, and they're able to really support the needs of the communities that they're serving.
Yeah,
and
and kind of reoriented the way that the practice of medicine is done.
Absolutely.
So that you have a physician
Yes.
when needed, but there also there's a team of care people that can
Exactly.
help at different levels.
Exactly.
Yeah.
And so with that, I think we're going to see this transformation happen. I don't think it's going to be overnight. So it's going to be something that will happen over time. And with time, we will figure that out.
Yeah. Okay. Well, I feel like I can still make some investments in front of this storm and do okay. And maybe we can partner and do a deal with Banner too.
There we go. That would be great.
So talk to me about your themes. You mentioned that Banner has some themes around innovation that sort of inform how you look at deals and partnerships and ideas. What are the themes now, if you can share them, or what is the...
So I was actually referring to our strategic themes.
Yeah, and then so the Banner
yes.
has themes, and then you try to invest alongside those. Or
Yes, that's
in
correct.
line with them. Yeah.
Yes, that's correct. So there's 4 strategic themes.
Okay.
First one is growing our reach and impact, and that's really around the growth that we would like to encourage amongst Banner, as well as the communities that we serve. We really want to ensure that we're building that relationship and continuing to grow that impact.
So is that in geography or in different types of care?
Both.
Okay.
Both.
Yeah.
Yes.
Okay. You coming to Nashville soon?
Will you have us?
Well, yeah, we will have you, sure. More hospital systems here are better for me.
There we go.
Yeah.
Who knows? I'll say
Okay.
who knows.
Yeah.
Who knows what the future holds? Our second is about engaging and inspiring our people. So really coming back to our conversation around clinicians and providers and staff and all of the healthcare workers that we have in our system. We have 50,000 team members, and we really want to ensure that we are continually engaging and inspiring them. And as an innovation group, we're also very passionate about how do we proliferate our culture of innovation amongst all 50,000 team members.
That's a really important one, because I think a lot of healthcare workers got in to make a difference. It's a calling, right?
Oh yeah, 100%.
But a lot of them are tired and burnt out and have sort of lost the ability to see how this calling is making a difference. So you getting them back and inspiring and empowering and bringing the culture so they can innovate is wonderful.
Absolutely.
Yeah.
Absolutely. And our last two, as probably not a surprise to you, are focused on our consumers. The first of those two is helping our customers be their healthiest. So really delivering on the basic core operations of a healthcare system. We really want to ensure that we are encouraging their health. And then also perfecting the consumer experience. So that's our fourth theme, and that's probably one that is a great driver for us in terms of how do we meet our customer expectations and really meet them where they're at, and again, create that relationship over time.
So talk to me about in the inspiring your team or in the patient engagement experience. Give me a couple examples or an example where you see that that has potential to really make a difference. Are there projects or maybe something you invested in or a partnership that you're working on?
I can speak
maybe
to a
something
project.
that's not private that you could announce.
Sure.
Yeah.
Sure. So I can speak to a project that I actually had worked on when I was involved in our labs group.
Okay.
And it was around our pre-surgical experience and how we really improve that experience.
Okay.
And
so before
and
you
growth from
explain, just because you mentioned it quickly, what does the labs group do compared to what the venture group does?
So the labs group is really focused on an empathy-driven design cycle. And so we really are going to take these novel, emerging, unproven ideas and take them through this design cycle to create the solution, prototype it, test it, and then roll it out across.
Yeah, a normal design thinking sort of process.
Absolutely.
Yeah, so you apply that inside the hospital
Yes.
in what's called labs.
Absolutely.
That's
yeah.
brilliant.
So within our organization,
Yeah.
we'll go through that process, and we're hand in hand working with our operational leaders, the staff. We have our frontline staff at our design sessions.
Okay.
So
Yeah.
that it's really a solution that's designed by them.
Yeah.
We're really just there to help facilitate and bring out that innovation level of idea.
Yeah. Okay, excellent. So talk about this project from that point of view. Like, how did it come in? Did it go
Sure.
through the labs process?
It did.
Okay.
It went through our labs process. And so we had a design session early on that was informed by a pain point that we were experiencing around case cancellations in the surgery
Okay.
areas in our hospitals.
Yeah, really hard when everyone is geared up for a surgery and the patient cancels.
Exactly.
Yeah.
Exactly. And so one of the greatest pain points that we saw was that preparation process from the time that surgery is scheduled to the time that our consumer is walking in our door.
It's difficult for the consumer or the staff or
You know,
both?
it's more so it's difficult for both because there's a communication barrier that we're experiencing. So as Banner, we're an integrated system. We don't only employ our physicians, we also have contracted physicians. And
Yeah.
so there is some transitions of care that need to happen and communication of information that is, when it doesn't happen in a very seamless way, we get to the day of surgery and then we're saying, okay, let me make sure we have everything. Instead, what most facilities have is a pre-admission testing department. And so what we decided to do with this process is how do we streamline this process to ensure that we are going to reach our patients ahead of time, usually via a phone call,
Yeah.
and ensure that we are connecting with them, helping them understand what they need to prepare for their surgery, what types of pre-op instructions they might need to abide
Yeah.
by. And that
Because
way,
when they show up and they had a big omelet for breakfast, that is not
No good.
ideal and no good, and they're frustrated and the physician's frustrated, everyone's
Exactly.
frustrated. Yeah.
Yes. So with that, we're really focused on how do we smooth that experience? How do we
Yeah.
increase the transparency? And then how do we ensure that surgery goes on as scheduled? Because it's not only frustrating for our physicians, our staff who are there and ready to go, it's frustrating for our patients because
Yeah.
they expected to have their procedure that day.
Yeah, and they just didn't understand. And so,
Exactly.
And they're frustrated that they weren't told. Or,
Yes.
Yeah.
Yes. And so
Okay,
that's really the core of it.
Did you pilot something and then has it rolled out around the system? Is that how labs works?
Yes. So
Okay.
so we start with a small test, and then we will roll it out at a facility to ensure that it is going to sort of achieve the same results that we experienced in the test, and
Yeah.
then it goes on to be rolled out.
Okay.
across
And
the
so
system.
when did it first come into labs and where is it now?
So it first came into labs early last year,
Okay.
and we are successfully at our full facility at this point.
Okay. Wow.
Yeah.
So that's pretty fast process.
Full first facility, I should say.
Yeah.
So
Yeah. So how many facilities does Banner have?
29.
Okay, so you went from concept, this is the problem, to fully rolled out in one. Mm-hmm. And then do you think it has a chance to roll out across the system?
Absolutely. Yeah.
Okay.
Yeah.
And so you've got to be excited and proud to see that impact. Mm-hmm. Right? I mean, there's a financial impact, but more importantly, it's an impact to the people's life, right? That they are having better procedures, the docs and nurses are happier, it's better all around.
Yes,
Yeah.
everyone wins from that perspective.
Right,
And
right.
that was exactly the feedback that we received when we went and talked to our patients who went through the process. We talked to the doctors, we talked to the nurses, we talked to all the staff that were involved, and it was a huge impact.
Yeah.
Yeah.
So out of Banner, how many projects come through labs or come through the venture group a month or a year or a quarter? Give me a size of an understanding of the scale of what you're looking at.
That's a hard question. So we basically have a number of requests that will come to us.
Okay.
And so it's
From
it's all
internal
about-
or external?
So internally focused is our labs group. So
Okay.
if there's an internal request around an idea or a pain point or a priority, it will
Something
usually
bubbling
come-
up,
There you
either
go.
concern or an idea bubbling
Yeah.
up will come to labs.
Usually,
Yeah,
yes.
okay.
And then if it looks like it's something that's more so a partnership or an external startup or whatever that might look like,
Yeah.
so that sort of external innovation, then it will come to the ventures.
Yeah.
And so with these two, I would say it's a large number. I don't have a specific number for you at
Yeah.
this point. Because one thing I would like to bring up is our ventures group is actually quite new.
Yeah.
We really started
The whole innovation group is not that old.
No,
right?
it's not. That's very.
So just talk about that history a little bit.
Sure.
When was the innovation group started?
So the innovation group was really started about 2.5 years ago with the Imagine transformation that Banner Health went through.
Okay. Yeah.
And so this was really a point in time where we had gone back and re-looked at our mission, values, and purpose. And with that, we were able to recreate what our strategies and focus was going to be going forward to really meet where the healthcare industry is going today.
Yeah. So, for instance, we have managed big buildings called hospitals for years, but maybe that's not our mission and vision of where to go. Of course, buildings are involved in it, but let's reimagine what we're going to need to do, and everyone comes together and they create that, and the innovation group, which is labs and venture, grew out of that. Is that right?
Definitely.
Yeah.
Definitely.
And is it fair to say that that's because there was an understanding kind of at the C-level on down that you needed to break through this innovator's dilemma thing? You need to sort of get some new ideas into the flow.
Innovation absolutely became a priority.
Yeah.
And it's one of our 4 strategic growth strategies.
Yeah.
And so
then that's when they hired you and hired a lot of people on the
Yes.
innovation team to come in and solve it for them.
Absolutely.
Yeah. Excellent. Okay, so one of the things I want to talk with you about is kind of the timing of things in healthcare. Right, so healthcare is typically seen from the outside as highly regulated, insular, very complicated value networks, and sort of challenging to disrupt.
Sure.
Because, it's someone's mom on the table. Right?
Absolutely.
So we need to take patient safety and patient privacy really seriously, unlike maybe some other markets where if you're doing rides or food delivery or other things, it's not life and death. Right? So if my fries come and they're cold, I might be frustrated at the food delivery group, but it's a less highly regulated thing for a reason.
Absolutely.
Healthcare is really serious.
Yeah.
And yet we have been talking about it needs to change, and it is changing. I have a thesis that some areas of health are going to change more quickly than others.
Sure.
Give me your thoughts about sort of the pace of change and where you see it more likely to change quickly.
I think the pace of change is actually changing over time.
Yeah.
And I think we are starting to explore how we can disrupt ourselves, how we can create innovation groups like this, how we can really engage in efforts to further that change. And one really core principle that I think is helpful to come back to is how do we understand what our consumers are expecting? So that rise of the consumer, again, is very important to that. Yeah. And as we start to understand, hey, our consumers are asking us for this, but then we as a healthcare organization also have a responsibility towards having a goal of zero harm. And that comes back to that the gravity of what we do. We are dealing with life and death. And so that goal of zero harm is very important to us.
Yeah.
And so,
but to take your lab example, I expect Banner and every hospital to deliver the surgery with zero harm.
Of course.
And yet that's sort of the baseline, right? Of course I expect that. But I also expect you to tell me what my dietary restrictions are, so I don't, unintentionally ruin my chance for surgery.
Right.
And it's both end. You don't have to say like, okay, well, we don't take patient safety seriously, so we're just going to innovate and mess around. You have to do both and sort of raise the bar and not sacrifice patient safety, but also deliver a great experience.
Absolutely. And I think that's where healthcare systems are going today.
Yeah. I'm an investor, so I'm investing more on the kind of the periphery.
Sure.
Right. So I think, for instance, I've done a lot of work in eye care because eye care has been pretty competitive for a long time, and there's better market forces there for many more years. And so a novel innovation can get much faster adoption because
Right.
it's a super competitive market.
Absolutely.
And so there are some other places in healthcare that are not as advanced, sort of on the evolution of competitive progress. But I think about like orthopedics or
Sure.
oncology. There's some areas that I think are trending that way. Do you see that from your point of view at Banner?
I think there are areas that could potentially go first, but I don't know that it's going to be a straight line. So I
Yeah.
think in the past we've seen a lot of innovation happening in the ambulatory spaces. And we can give examples of CVS and of Walmart and different approaches that
Yeah.
we've seen. But as we consider our consumers, they experience all of healthcare. They don't experience just outpatient or inpatient
Right.
or ED or one or the other. So as their expectation is created in one area, they're going to come to expect that same level of service, that same type of experience in every other area of healthcare.
Yeah, and it's up to you or the provider to figure out how to deliver that.
Exactly.
To
And
their
so
expectations.
that's why that healthcare or that innovation really is going to happen in sort of a jagged line, I guess you could say.
Yeah.
Where it's going to happen in one area, and then there's going to be a ripple effect that will be noticed.
Yeah.
As
It's
other
interesting. It
areas
makes
meet
me
that
think to your
expectation.
futurist that I want to watch the video. I want to get the video from you later.
Absolutely.
About exponential thinking, right? Like it's going to be kind of slow change, slow change, slow change. But an exponential curve, all of a sudden, as consumers have an experience in one setting, then they want it in the next setting. So that
yeah.
over time, it gets faster.
Yes.
And then
Yes.
all of a sudden, we look up in 3 years and high quality customer service, customer experience is expected everywhere.
Absolutely.
Yeah.
Absolutely.
Okay. Excellent. What about, I always look for, I call them on-ramps, like where I can invest and then it could grow. So it's like an
Sure.
on-ramp to the interstate, right? So you could start somewhere
Yeah.
and then slowly expand. And I want to get your thoughts on sort of primary care as an on-ramp,
Sure.
and then also Medicare Advantage. So talk about those two starting places and how they might grow into a bigger system.
So primary care, I think, is super important because for a lot of patients, that's
Banner
where
have a bunch
they're-
of primary care
Yes, we
docs?
do.
Yeah. Yeah.
Banner Medical Group.
Okay. Yeah.
But yeah, so it's very important because it's really where the patient is starting to establish that trusting relationship.
Yeah. I mean, I'm going to
you
do
know,
whatever my primary care doc says.
There you go. Well,
Yeah.
and you're healthy, so you're probably that's probably the main encounter that you have
Yeah.
with your healthcare provider. And so for many of our patients, that's our main touch point with them. So it's super important for us to be able to deliver the right trusting experience there. And then that will really reflect on where we can send them from there. They're sort of the gatekeepers to say, okay, so something started to go wrong or has changed. So
Yeah.
how do we now direct you to your next step, where you need to go next? And
Yeah.
you're often going to trust your primary care
Yeah.
provider
And
to
then
get you there.
he or she will refer me to the next place.
Yes.
And I think that's the system that I understand, but I'm 49. I'm a Gen Xer, right? So the
Right.
younger population doesn't all have primary care now.
Right.
And so I know you have a partnership with Aetna CVS.
Mm-hmm.
I think the CVS Health Hub is a really interesting sort of way to
Absolutely.
do urgent care and chronic care, but then also pull in some of these people that don't have a relationship with a primary care doc on an ongoing basis, but they might
Right.
trust the Banner, Aetna, CVS flagship
Absolutely.
of brands.
Right, right. And it's another avenue for us to be able to again grow our reach and impact to our consumers and our community of patients that we serve.
Yeah.
So it's absolutely another avenue for us to be able to create that relationship. And so
Now-
it doesn't necessarily have to be that one-on-one relationship with your primary care anymore. It might be that you trust the Banner brand.
Right.
And that's ultimately where the future could potentially go as we
Yeah.
start to put more faith in brands over individuals. And that's, again, a trend that will consumers truly go that way or not, we'll figure out over the next coming years.
But the beautiful thing about the innovations group is you can put kind of test balloons out there and learn
Absolutely.
from them.
Yes.
Yeah.
Exactly.
Yeah. And I see there's some groups on the West Coast that are sort of attacking primary care through employers. And I think they could grow to be significant competitors as they start to build trust with a group of, fairly healthy, fairly profitable patients.
Right.
And maybe they then take their referral patterns and could come to Banner and say, we'll refer all of these patients to you, but only if we get certain deals.
Absolutely.
And so what's interesting is Banner is able to sort of learn about this at the same time, prepare itself and be ready to combat against it whenever it comes.
Exactly. And that's really why we're sort of banking on how do we co-develop the future model of healthcare, because it includes all of these different aspects that are being tested and tried. And we'd like to be on that leading edge, and we are on that leading edge as a healthcare system to be able to position ourselves to deliver that when the time is right.
Yeah. So not so much in the health system, so you may not have studied as much, but Medicare Advantage I see as a really interesting sort of model for how all of Medicare may go over time, just because it aligns the payer, the Medicare Advantage plan, with trying to get the consumer more healthy in a way that aligns the profit motive, right? So they are motivated to try to get that patient engaged, change their behavior, change their diet, make sure they see their primary care doc. Absolutely. And then if something happens, because Medicare Advantage is all older folks, if something happens health-wise, let's get them to the best care possible, and hopefully get them recovered. That's a very different incentive structure than normal Medicare, which is sort of every time they show up, we bill.
Fee for service.
Right, exactly. Have you looked into that at all, or what's your thought about Medicare Advantage?
So Banner does have Medicare Advantage plans.
You have your own plan?
We have our Banner Health Network, and there's a Medicare Advantage plan offering, because as you might know, Phoenix is a community that has a large senior citizen population, and so that's a huge percentage of the patients that we serve, and it's very important for us to really prioritize wellness, and that's one of the areas of focus that we'd like to explore going forward is what does wellness look like to our consumers, and our consumers range all ages. We have the younger families as well as the older senior citizens, and so wellness as it evolves will really apply to all of those age ranges. And so Medicare Advantage specifically has their own priorities, kind of speaking to how you've described this plan of, they're incentivized to keep their patients healthier. And so wellness is one aspect of that, and we'd really like to be able to offer that. Yeah,
and I sort of have this belief that people in general want to be healthy.
Absolutely.
But they don't have the education, or it's not convenient, or they don't have the easy access to the decision structures or the food or childcare to do it. So there's all these non-health things that end up relating to it that need to be sort of taken holistically and solved for.
Absolutely. Yeah. Well, and wellness, the more we explore it, the more we start to see that it's not just about healthcare. It's really about the financial, the social, the nutrition, your education. There's so many different factors that go into it. And that's really kind of starting to speak to how healthcare is broadening in terms of its scope. Yeah. It's not just about the care that you go to the hospital to receive. It's a broadening field over time.
Yeah, I completely agree. So I'm trying to change the semantics, the language around it, because I think healthcare is traditionally thought as doctor, hospital, insurance company, pharmacy.
Right.
And so I've been talking about healthcare as a subset of health, right? So you need diet, fitness, coaching, behavioral health needs to be in healthcare, but sometimes it's excluded. So health is all of those things sort of together. And of course, they're all interrelated, so we need to solve it kind of all together.
Right. Absolutely.
I just sort of was interested in your thoughts about Banner's value about courageously innovate, because that's an interesting choice of a value for a health system.
Sure.
And it makes more sense now that we have talked. But talk about the transformation and reimagination and the value systems of Banner overall, and then particularly the courageously side of Innovate is what I was intrigued with, because that kind of implies that there's going to be some challenging aspects of it, or things that you need to be courageous to push through.
Sure. So, with courageously innovate, I like to sort of break up the value into its two component words. Yeah. So from an innovation perspective, we at Banner have defined innovation as novel, emerging, and unproven ideas that shape the future model of healthcare, earn loyalty, and drive strategic growth for Banner. And so these are.
I love that you've defined it, because people throw innovation around all the time and don't know what it means, right? Except it sells tickets.
Well, and that was one of the first things that we did when we came together as a Banner Innovation Group, because we are built upon innovation. That's what we do. But then when you ask us what is innovation, it was something that we decided.
Yeah, and to get alignment and be intentional about what it means. Yeah,
exactly. Yeah. And so with that, these novel, emerging, and unproven ideas is really what we're focused on. And so that's the criteria that we will pass through most of our work.
Yeah.
And any body of work that we would decide to take on should abide by this definition.
Yeah. And so if it's peer reviewed and has been studied for 30 years,
probably
it's not any of those things.
Exactly.
And so it could be really cool, but it's not innovative in the term when the definition you're giving.
Exactly.
Yeah.
Exactly. And so, then we'll find the right person to take that work on.
Right.
And then from a courageous perspective, it's a little bit of what we just touched on, where we're going to say, hey, this is not actually abiding by this definition of innovation. So let's find where you should go. We're not the right people to do it. Someone else is.
Yeah.
And so we will find that. But the other side of it is really coming back to some of the principles we had spoken about earlier, where we will not necessarily take on work just to gain a return, or just to go by the traditional definition of a venture group where it's about the financial return. We're really going to be very bold and disciplined about how we are abiding to our definition of innovation, and really being strategic in what work we're going to take on to ensure that it aligns with our strategic priorities as well as aligns with our culture.
Yeah, it's really interesting. So I hate corporate VCs typically. Luckily,
Okay.
You're not one of them. But in general, they are not courageous, and they are sort of doing incremental things that are going to help the mothership generate, sort of an advantage in negotiation about something else. And then after 2 or 3, 4 years, the corporate structure decides, well, it's not really that profitable, and so they abandon it.
Sure.
And so you get this sort of continuous revolving door of people giving lip service to innovation, then they don't actually want anything that's risky, and then it disappears. And it strikes me that you're saying things that are sort of leveraging the strengths of Banner.
Absolutely.
And even taking more risk, or in your lane of health and health systems and wellness, really you can test and learn almost further out than a VC like I would be, because it's not purely financial. There's a mission-driven thing, and of course you want financial returns, but it's more about making an impact in health.
Yes, absolutely, and that's exactly how we think about it. It's more than just the financial returns. That's a basic requirement, but we want to ensure that we are co-developing that future model of healthcare, and that's really what drives us.
Yeah, and I think you're in a data set of one. As far as like health systems that are taking that courageously innovative approach.
Sure. And
so I applaud it. It's incredible.
Thank you.
And so hopefully you'll find some great stuff and let me invest like alongside you and just kind of like follow in the kind of pathway with you.
Create a partnership there.
Yeah, sure. So you have been doing this about 10 years or so, came out of industrial design. I ask all my guests this question, but what do you wish that you could tell your younger self? What do you wish you knew 10 years ago that you didn't know that you sort of have learned now?
When I was younger, when I was first starting to work, I think one thing that was very important to me was being very results oriented and results driven. And it was all about the end product, the end result, getting that right. And what I didn't maybe take as much notice
Independent of how you got there?
There you go.
Yeah.
You just stole my words from me. That's okay. But yeah, I didn't really take much notice of how I was getting there or why I chose the pathway that I chose. Mm-hmm. And what I've learned over time is that the why and the how can be just as important as the final result. Because just because you got there doesn't mean that that's the way it's going to end up, going forward. And also, there's so much value in those two components. So in terms of the how you got there, if it was successful, especially in terms of innovation, we want to know how we did it so that we can replicate it.
Yeah.
And if it wasn't successful, then why wasn't it successful? So we can learn from that. And then next time we go about some body of work, we can use those learnings as well as the how learnings and say, okay, we have this extra level of knowledge and information. How do we build upon that?
Yeah. So would you say that in this world of sort of big transformational change, mm-hmm. a lot of unknown, mm-hmm. that the why and the how mm-hmm. become more important, right?
Absolutely.
I've been saying a lot, the journey is the goal, right? I don't know where we're going to go in our investing or with this video mm-hmm. series or where Banner's going to go or where healthcare is going to go. But if we do the why and the how correctly, then we'll get to the right place.
There you go. I do believe in that very much so because it's kind of like in our conversation today, we've had so many questions that have come up, and we don't necessarily have answers because those are all things that the journey will tell us.
Right.
And so it's really taking notice of that journey.
Yeah, what's interesting is Banner sort of taking the lead or going out there and mm-hmm. trying to find your way. Yeah. You will learn much more than other health systems that are kind of staying back, kind of in the safe area, but where they don't learn very much.
Yeah.
And then as the world changes, they may not be as prepared.
Potentially, as Banner, we really want to ensure that we're on the leading edge, but we also do want to ensure that we're part of this collaborative environment and able to share those learnings over time.
Well, the thing about health is parts of it will be sort of mission driven, mm-hmm. and if you find a better care pathway, you might help other hospital systems that are not in your markets adopt them. Yeah.
Well, it kind of comes back to some of a statement that's in our purpose as well, and it's about creating the future model of healthcare for America.
Yeah.
And so it's not only about Banner and the markets that we serve. We really do want to ensure that this is an industry-leading, changing entity.
Yeah. Well, it's important. It's our parents and our kids and our society, and if we don't figure it out, who's going to?
There you go. Exactly.
Yeah. Any other trends that we didn't touch on that we need to? Things I missed covering?
I think a lot of the trends that we spoke about today, the 4 trends, kind of led to some of the others that we were considering, like loyalty, like the changing human roles. I think these are all very important trends that we'll all have to keep an eye on going forward. And another one that we're looking at is wellness. So, we've been able to touch on a lot of them today.
Yeah. Okay, and then the last thing, how do you stay current? There's so many moving parts mm-hmm. and 24/7 news cycle. There's always new reports, new papers, new things coming out. How do you stay up on all these trends? Is there something that the viewers should watch or read or keep up with? How do you keep up with it all?
For me, it's all about, reading as much as I can. I love to read books. I love to read the news, read multiple articles. I've probably subscribed to way too many newsletters that come to my email. And we're all receiving those. We're all receiving the same information. And it's a great source of information, but what I find to be the most valuable actually is conversations like this, mm-hmm. where you're able to have a discussion about different perspectives, different ideas, different ways of looking at a solution or an issue. And the inspiration that comes from that is really what drives me forward and gives me a new way to think about things. And then you take that back and then you start researching that.
Yeah.
And,
so
it's just
you have an opinion, but then I challenge it and there's sort of a banter back and forth.
Exactly.
And then we both come away sort of slightly with different perspectives.
Exactly.
And then when I pick up a newsletter tomorrow morning, I'll read it slightly differently than I would have yesterday.
Exactly,
So,
exactly. And I think that there's so much value in that, and the value that we all bring to each other. So it's great to have this community of healthcare innovation as well.
Yeah. Great. Well, I'm glad that you came to town.
Glad
I'm
to be
super
here.
excited that you're here.
Yeah.
Really one of the most exciting conversations around health venture investing that I've had. So I'm excited that Banner's doing this. Thanks for doing the show.
Of course. Thank you
And,
for having me
have
again.
a good weekend in Nashville.
Thank you.
Okay. Thanks, Nikila.